4 years ago, 7-year-old Nolan Kiprop was diagnosed with type 1 diabetes. It was a diagnosis that left his family devastated.
On being confirmed that it was diabetes, I was so stressed because I didn't know what to do. I didn't know where to start because this is a lifelong disease. And so I had to see counselors who are able to counsel me and encourage me that there are even other children who have the same condition and have lived with it. And that is the time I accepted the situation.
With a strict adherence to insulin injections, Nolan is, however, leading a normal life.
I won it on tire racing. And this one, it was... You get inside a sack, you jump until the end, and then you sit on the balloon until it bursts, and then you go back. I won it on number 2.
However, with the high cost of living, the mother has to dig deeper into her pockets.
For the Lantus is what we spend 2,500 for the Lantus, and for the Humalog we spend around 1,800. So in a month we can say around 4,000. And then we have the strips. We normally buy the strips. A packet of strips is 1,800. So we can say that in a month we spend 6,000 shillings. And now, besides that, we also have his meals, because we have to ensure that he takes a balanced meal. We have to ensure we have vegetables, and we have to ensure that there is a protein and also fruits.
It is a challenge that Anderson Mwanzia, a resident of Kibera, can relate with. His 2-year-old son is diabetic. With his meager monthly wage, the medication for his son is far too prohibitive.
So 1 week spending 2,500, that's only the strips, not without the insulin, without the injections. That's budget only going for the strips only.
So in a month is like how much?
In a month, it's around 10,000. Because my income, so that's less than 20,000, it's 20 and below. So if you are to put aside 10,000, you haven't paid the rent, you haven't bought the basic necessities. In fact, you can't make it.
Diabetes Management Information Center, a non-for-profit registered medical charity, has, however, made life easier for his family.
So we've come up with a system whereby we partner with some companies and well-wishers, where we are able to give them free medication, free insulin, glucometer, strips, syringes, and we also do conduct youth camps during school holidays, whereby we bring the children and parents and sometimes teachers to educate them how to cope and how to be able to integrate living with diabetes in the community.
According to the Public Library of Science report of 2017, the high cost of non-communicable disease treatment, where diabetes is included, and low rate of insurance coverage significantly limits affordability for most of the population. A report by Daktari Africa exposing the dire situation, revealing that only 12% of Kenyan families have insurance coverage. With the government subsidies on insulin, most patients are still finding it difficult to afford diabetes healthcare. Despite the cost that comes with the endocrine disease, Dr. Joyce Mbogo says there is light at the end of the tunnel.
A couple of months ago, we had a prime minister who came to Kenya. Theresa May has type 1 diabetes. And the reason I want to point out, and we do have our own champions within this country, that irrespective of the fact that you have diabetes, that is just a small thing. The sky is the limit. The sky is the limit, the potential is there. That does not stop you from achieving your dreams, and that your future is bright.
34-year-old Joseph Mwaura from Thika, who is now a family man, was diagnosed with diabetes at a tender age.
I am 34 years old. and I have lived with diabetes as a condition since 1999. That is the time that I was diagnosed. I was still young because I was in high school. I was in Form 1, Form 2 actually. It is good for parents who have kids who have been diagnosed. They can also get empowered, especially with the technology of internet. Nowadays you can get so much information, and also there are forums. There are so many forums that are going on for either parents or the caregivers of people who have this condition.
Dr. Mbogo advises Kenyans to maintain a healthy lifestyle and frequent sugar checkups every 4 to 3 months for both children and adults.
Because of the delayed diagnosis, if you notice that your child or your student or your neighbor seems to be drinking a lot of water, seems to be peeing a lot, seems to be losing weight, in other words, those trousers were fitting them tighter but somehow needs to have a belt, go to the nearest dispensary. Ask them to check your blood sugar. If the blood sugar is found to be high, refer them to the nearest facility that they can be able to seek extra help. So the fact that we are being able to diagnose children with diabetes is a first success, I have to say, within the Kenyan community.
Under the universal health coverage, diabetic patients will access treatment at low cost using a universal health care card under the recently launched universal health coverage program once it rolls out in all counties. Diabetes is becoming increasingly common in children, especially in developing countries. However, there are ways of preventing and controlling its progress. Professional and public awareness of the risk factors and symptoms of the disease are an important step towards preventing and controlling it. Sheila Yogo reporting for Channel 1 News in Ongata Rongai, Kajiado County.